Hey guys, welcome back to Medical Coding with Blue. Today's episode is a question that I have gotten more than once over the last 2 weeks. I don't know where this question is coming from, but it's driving me nuts because I don't know where people are getting their information, and it really doesn't matter. But here's the thing. If you are looking into becoming a medical coder and you start doing research and you start listening to a bunch of different people, you are going to get a bunch of different answers. You're going to get a bunch of different opinions and ideas about what this field is and what happens to you when you get in this field. So I would recommend that if you are seriously wanting to get into this, that you minimize your asking of questions and listening to people, because not everything everybody says is the truth. And if you've been into these fast-paced medical coding programs, you know exactly what I mean. They make a lot of promises to get you in, and then, you know, they've done their part. The rest is up to you. But here's the question, and I'm telling you guys, I've gotten this question more than once over the last 2 weeks, phrased kind of the same way. So I don't know if I'm being punked or not, you know, and if you come from that time, you remember the show Punked with Ashton Kutcher? The question goes, "Hi Blue, I like your channel." The other one said they love my channel. Thank you for uploading videos about medical coding. Just a question. Is it true that medical coders develop carpal tunnel syndrome? Is there a way to prevent it? Thank you. Now, I did an episode about health and medical coding last week, and I talked about, you know, the things that you can do to keep yourself healthy. This was one of the questions that I responded to about carpal tunnel in specifics. Here's the thing. If people are telling you, oh, medical coders develop carpal tunnel syndrome, here's the thing. You Google carpal tunnel, right? And here's the thing, carpal tunnel, if you don't know what it is, carpal tunnel syndrome is caused by pressure on the median nerve. The carpal tunnel is a narrow passageway surrounded by bones and ligaments on the palm side of the hand. When the median nerve is compressed, symptoms include numbness, tingling, and weakness in the hand and arm. The anatomy of the wrist, health problems, and possibly repetitive hand motions can contribute to carpal tunnel syndrome. Proper treatment usually relieves the tingling and numbness and restores the wrist and hand function. And this comes from the Mayo Clinic. And I'm going to be leaving this link in the description box below so you guys can look at this. But here's the thing, causes. Carpal tunnel syndrome is caused by pressure on the median nerve. The median nerve runs through the forearm, from the forearm through the passageway in the wrist, the carpal tunnel, to the hand. It provides sensation to the palm side of the thumb and the fingers, except for the little finger. It also provides nerve signals to move the muscles around the base of the thumb, motor function. Anything that squeezes or initiates or irritates the median nerve in the carpal tunnel space may lead to carpal tunnel syndrome. And then it talks about risk factors. So a number of risk factors can be associated with carpal tunnel. Anatomic factors: a wrist fracture or dislocation, or arthritis that deforms the small bones in the wrist can alter the space within the carpal tunnel and put pressure on the median nerve. Your gender: carpal tunnel is generally more common in women. This may be because the carpal tunnel area is relatively smaller in women than in men. Physiologically, we are different from men. Women are designed different from men. Men are designed different from women. And so because of this, we have different size bones, different density of bones. And so this is what this is talking about. Nerve damaging conditions. Some chronic illnesses such as diabetes, increased risk of nerve damage, include damage to the median nerve. Inflammatory conditions. If you have rheumatoid arthritis or other conditions that have inflammatory component that can affect the lining around the tendons of the wrist and put pressure on the median nerve. Different kinds of medications. Obesity can also affect it. Body fluid changes. Fluid retention may increase the pressure within the carpal tunnel, irritating the median nerve. This is common during pregnancy and menopause. So if you're going through pregnancy and menopause, are you automatically thinking, oh gosh, I'm going to get carpal tunnel syndrome? No, it's just the way that the body reacts to whatever is happening to it. It is not because you're becoming a medical coder, and it is not because you are a medical coder. Okay, let's just get that distinction out of the way. Other medical conditions, certain conditions such as menopause, thyroid disorders, kidney failure, and lymphedema can increase the chances of carpal tunnel. Then it says this: workplace factors. Working with vibrating tools or on an assembly line that requires prolonged or repetitive flexing of the wrist may cause harmful pressure on the median nerve or worsening existing nerve damage, especially if the work is done in a cold environment. However, the scientific evidence is conflicting, and these factors haven't been established as a direct cause of carpal tunnel. Okay, it just says that you may. Okay, it doesn't mean that that's what you're actually going to get, right? And it says several studies have been evaluated on whether there is an association between computer use and carpal tunnel syndrome. Some evidence suggests that the mouse use or not the use of a keyboard may be part of the problem. However, there has not been enough quality and consistent evidence to support extensive computer use as a risk factor for carpal tunnel syndrome, although it may cause a different form of hand pain. So here's the thing. I don't know who is saying this. Who is saying that, oh, medical coders are going to get carpal tunnel syndrome? Whoever is saying that, again, look at the source. And what are they trying to sell? And what are they trying to push? And what is their agenda? Think about those things, because people will say things to serve themselves. I have nothing to sell you all when it comes to a medical coding program. Yes, I have services, but that's something separate from what I'm talking about here. People keep saying, oh, carpal tunnel syndrome and medical coders. Guys, I just read to you the risk factors for what happens with those things. And if you're really concerned about protecting your body and you know, lowering your chances of getting this, take care of your body. I said in the last video, make sure that you're getting up. Make sure that you take rests. Make sure that you look around and move your head so that you don't get that eye strain going on. Make sure that you stretch. Make sure that you try to do walking even 30 minutes a day. And you get 2 15-minute breaks if you work 8 hours, right? Typically, you get a 15-minute break for every 4 hours that you work. Some places that's different, but that's typically the way that it is. You can get up and move around. Move around, stretch, you know, take the time to really pay attention to how you're feeling. Make sure that you're set up in an ergonomic, friendly workstation, okay? Make sure that you're drinking water. Limit your intake of caffeine. That's all important, because we sit in a job all day long. We have a very sedentary job. I'm surprised more people don't ask me about, oh, well, you know, will you gain a lot of weight being a medical coder because you're always sitting down? I'm surprised I don't get that question. No, I get the carpal tunnel question, okay? So hopefully this will knock that question out, because again, that to me is just ridiculous that somebody would even say that, okay? I know many coders who go their entire career, no carpal tunnel syndrome. Carpal tunnel syndrome can happen to anybody, you know, given those risk factors. And it happens to people who don't even have those risk factors. So again, don't listen to people that are putting that crap out there, because that's exactly what it is. Let's just be honest. That is crap. Because for people to say that, it's like, really? But it's probably the same people that say, oh yeah, you make this really high, ridiculously high amount of money as a medical coder when you first start. Okay, whatever. If you want to know what medical coders make, you can look in the Department of Labor or the Bureau of Statistics. I said it right at the time. So check those websites out, and they'll be able to tell you what the starting salary is. We don't talk about money on my channel. Never have and never will. I always tell you guys, because it's different in different places. And sometimes people only get maybe 1/10 of what I'm saying, and they run with it. So I have to be very careful about the things that I talk about, because people don't always interpret what I'm saying the way that I'm saying it. So that's why I say, if you want to know about money, go to the Department of Labor or the Bureau of Statistics. Don't ask, oh, this school, that school, because the school is trying to sell a program, all right? And I don't know what what fool is saying this about medical coding and carpal tunnel, but don't listen to that. Let's use some common sense, guys. Let's use some common sense here when it comes to, oh, this and this and this about medical coding. If you're in school, start studying. Don't start talking to people. Don't start sharing, oh, I'm going to do this and I'm going to do this medical coder and things like that, because people are going to give you their opinions. The more you share about your journey and your success and the things that you want to do, the more you're going to get people who are jealous of you and who want to stop you from doing anything, because either they can't or they will not do that in their life. So they want to keep everybody down with them. Meanwhile, you know, if you're actually paying attention and doing what you're supposed to do, concentrating on this, you're not going to be messed up with all this other negative talk that you hear out in the world, right? This is why I tell y'all to stay out of those Facebook medical coding groups, because that's all they are, is negativity. And for those who say, oh, Blue, you're a Debbie Downer and you only talk about the bad things, that's not true. I have over 900 videos on my channel, and I do talk about the positive things about medical coding, but I want y'all to be realistic about all the things that people say. Not everything that you hear is going to be true, okay? Yes, people get carpal tunnel every day. This is just something that just happens in the body. It doesn't mean that they didn't take care of themselves, but they just happen to get it because, again, they have these risk factors. But it doesn't mean that this happens to everybody. Do not let that cloud you from, you know, doing this or stopping doing medical coding, because if you're going to sit there and think of every single weird thing that you could potentially get and not really want to get into it, then you're making excuses already not to get into medical coding. Okay? Don't be that person, because this field is expensive, and if you're paying for that program, well, you're already putting out money. So why talk yourself out of it, or why do all these other things? There's a lot of things that can affect medical coders because we sit all day long, okay? But again, watching what you eat and being more conscious about drinking water, making sure that you move, can mitigate some of those problems, because again, it's all about how well you take care of yourself. So you have to take care of your body, take care of your mind, which means staying away from negativity, staying away from people who are saying fool things like that, and you know, staying away from, you know, any negative force out there, because you are the captain of your own vessel and you are the one who is in charge of your life and how things go for you, because life goes by just like that fast. And for some, there's people who say, well, Blue, I started this 10 years ago, but I quit, but I'm coming back to it now because I want to do it, but now I'm not really sure. What are you doing? You already let a whole decade slide by, and by the time you know it, you're going to be at retirement age, and then what do you have? So don't waste time, guys. Stick with something. If you're going to start with this, and don't start thinking far ahead. Oh, well, I'm going to develop carpal tunnel. That is the most ridiculous freaking thing I have heard. So again, I don't know who is saying it. It doesn't matter. Please don't put it in the comments, because I don't want anything on my channel about that anymore. Hopefully this will be the last time we have this conversation about carpal tunnel syndrome and medical coders, okay? So again, I'll be leaving this there. I have the same access to Google as all of you. So if there are things like that that you're hearing, then do your research. This is going to be your field. You are going to know about all these different conditions, right? May as well start now, and you look there and you can see, how do you prevent this? How do you take care of your body if you have a sedentary job? There's plenty of websites that are out about that, but people will say, oh no, Blue, I don't want to exercise. Okay, well then that's up to you, you know. And as you get older, I know, because this has happened to me before, you sit down too long and all of a sudden you get up, and man, it's not the same as when you're getting up when you're a young spring chicken and, you know, your bones and your bones and your joints don't ache. When you get up, you know, sometimes it's like you hear bones cracking. I know my knees crack. And sometimes I'll move my elbow and my elbow will crack. So, I mean, it really all depends, you know, how long I've been sitting. But I try to make it a point of, you know, getting exercise and eating right, eating whole foods, staying away from things that are bad for me, because I already know myself. I know how I'm going to react to certain foods, and I try to stay away from those. And I have been being very serious lately about walking. So I'm doing between 10 and 15,000 steps per day. And that is incorporated with exercise. I've been doing 30-minute workout videos that I found on YouTube that I love to do. And there's a lot of really good people out there that do exercise videos that will really help you, and your clothes fit better, you feel better, and you get more energy when you exercise, believe it or not. I used to think that was baloney when I was younger. Oh yeah. But you know, then I realized it. You know, I've always been very active as far as like doing things. I delivered phone books for many years. So what does that tell you? But it's just one of those things that you have to get into. You have to make it a point for yourself, you know. If you're staring at a computer screen all day, of course you're gonna get eye fatigue. So make sure that you move your head from side to side. Make sure that you take the time to not have like all this bright light in your face all the time. You can use those screen protectors. You can turn on like the blue light filter. Some computers have that. Some computers, they have those screens that you can put in front of it, so you know, kind of lessen the blue light. It's the same thing with your cell phones. I have the blue light filter on my cell phone, so I keep that on at all times. So it's just, again, it's a matter of taking care of yourself. So I hope this answers y'all's question about carpal tunnel and all that mishigas. But again, guys, don't listen to everything you hear from everybody that says things about medical coding. Really, you know. But anyway, I'm gonna wrap this one up. Thank you guys so much for joining me. If you've been studying, leave that blue heart. The blue heart tells me in the comments that you're studying, and you don't have to say anything. You don't have to tell me what you're studying. You don't have to tell me what subject you're on or what chapter you're in. But that little blue heart, that way I know out there who is studying for their test, who is you know, taking their test and now they're studying because they're out there looking for a job. Okay, let me know. Leave those blue hearts. I love the blue hearts. I've been seeing them lately, so that really just makes me so happy. It's the little things for me that make me happy. Anyway, I'm gonna wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.